Hello, and welcome to a quality improvement project to close gaps in care, an interview with Ms. Carrie Levine, an RN and manager in the quality department where I'm currently employed. The project overview, as described by Ms. Levine, was aimed at closing gaps in care for over 13,000 Medicare members that were enrolled in a Medicare Advantage plan in the state of New Jersey. And these members were identified as missing certain screenings that were going to be targeted for this project. And the project was conducted over the second half of 2018. The goal or aim of the project was to decrease health risks, to improve these members' overall health status, and to reduce costs. And when Ms. Levine was asked, what would you identify as a critical indicator of professionalism in professional nursing, her response was threefold. First, she stated that respecting and treating others as individuals, being genuine, and then also being accountable for providing high quality care. And third, acting with honesty and integrity. When Ms. Levine was asked about what did she consider important in developing a collaborative team approach in the healthcare organization, she described that the current organization, the teams are really divided into departments such as case management and utilization management, and they really normally work independent of one another. But in such a project, the teams came together, worked collaboratively for this quality improvement project, and sometimes she stated that they also do come together on cost savings initiatives within the organization to implement those cost savings. She stressed that communication between the teams was very important, and it contributed to the success of the project. And during the project, she had mentioned that communication in the planning stage was a collaborative team meetings that they held. A process flow chart was created to have all the teams put their input of how the project would be managed and what process the project would take and which stakeholders would be accountable for each of their team's process within this project. The implementation stage of the project, she said, included continued meetings. There were also reports that were generated that were distributed to each department, and then within the departments, those would be completed. They would be sent back to the quality improvement team, and that's where they would be analyzed and assessed the process. She also did state that after they completed the process flow chart, that they created workflows for each of the teams so that the, say, case managers at the level of calling the members would understand what their role would be, and also the pharmacy staff and what their role would be. And then I had asked her to give examples of standards for effective teamwork and collaboration that she experienced throughout this project. And she said that multiple teams were included. They used a case management team, a pharmacy team, also a communications team. There were claims department that was included, a legal team, and her team, which was the quality team. And I asked her, what did she see as a distinct collaborative contributions between these different teams and different roles, and how that affected the project? So she had explained that the case managers were initially the ones who would call the members. They felt that member engagement might be a problem, and since the case managers were very familiar with engaging members, getting them enrolled in case management, that they would be good at accomplishing getting these members enrolled into these screenings. Also, the pharmacy department, which was managing the medication therapy management program. The legal team had to review the project to make sure that it was meeting all of the CMS guidelines and also that it was compliant throughout the organization. And there were gift cards that were used as an incentive for members to complete their screenings, and that also had to go through the legal department. She said that communications is normally the team that sends out mailings. They had generated flyers and also mailings about the gift card incentive. The claims department would be pulling the claims after the members had completed the screenings, just to verify that those were completed, also to capture that data and to verify that that had been completed in order to send out the gift cards. And then the quality department was overseeing the project. They were organizing and tracking the progress of the project and would be assessing the overall success of the project. As far as barriers, she stated that they did have barriers that they anticipated would be a problem, and one of those was member engagement, which she said that's why they had enrolled the case management program on twofold, because the case managers are used to talking to the members, and also members that maybe were identified during these calls to be enrolled in case management as well as completing this quality project. Secondly, she said that a gift card incentive was offered, and when the members would complete the screenings, they would receive a CVS gift card that ranged anywhere from $15 to $50, dependent upon the screening, as long as they completed the screenings before the end of 2018. And also, she said it was kind of a barrier, or took some coordination to get all the teams together and make sure that all the steps were covered and there were no gaps in the process. The overall screenings that were covered, they chose 4 different screenings. The first one was the colorectal cancer screening, and the case managers would review different types of colorectal cancer screenings and also encourage them to speak to their primary doctors in regards to which type of tests would be appropriate for them. The case managers also assisted in setting up those tests or connecting the members with physicians in their area if they did not have one in place. So say if they didn't have a primary care doctor, they could set them up or give them in-network doctors within their area in order to have these annual screenings and just an annual checkup to be done as well. The next was a breast cancer screening, and that was offered for any woman over 40. And since we were dealing with the Medicare population, again, they were referred to speaking to their doctors because some women were over the age that it was still considered needing to be done annually. The next one was for diabetic testing, and the case managers would review that the A1C, a kidney function test, diabetic eye exam or retinal exam, and an annual foot exam were completed every year for any of the members that were diagnosed with diabetes and had not previously had those tests throughout the year. And the last one was for medication therapy management. And in order to qualify for this, the members would have had to meet the Medicare or the CMS guidelines for the program, which included certain chronic diseases. They had to have Medicare Part D. They also had to meet a certain financial requirement in order for this program to be in place. But when a member was identified, they would then be referred to the pharmacy department, who would educate and coordinate services regarding the member's medication. And the data being collected. So as reviewed by Ms. Levine, she said the data was tracked and reported by the case management and pharmacy departments for those members who were either completing them, scheduled to complete the screenings, or enrolled in that medication therapy management or MTM. And then all of that data would be processed against the claims. So it was verified against the claims. And they said that they analyzed the process using that process flowchart and also the data reporting. And as I had mentioned before, the outcomes would be analyzed using the pharmacy case management and claims data. As far as if the change was an improvement, initially she said the preliminary results were very promising. They had much higher numbers of these same Medicare members that have been enrolled in this Medicare Advantage plan for quite some years, that their numbers were increased over 2017. And by the end of December, they had sent out over 900 gift cards, which meant that 900 of these screenings had been completed. And she had also mentioned that they are working on an initiative for 2019 in the early stages. And again, it would be put in place in the second half of 2019. And they were focusing on different screenings for this upcoming year. She had stated that the data was still coming in due to claims. The doctors had so many months in order to get those claims in that they didn't have all the data as of yet. She said it would take approximately 6 months for all that data to come in, and then they would be able to make a better assessment of how much this project had improved or how many members they had touched and helped to get the screenings. So that is the quality improvement project that was completed, and thank you for taking the time out to listen to me today.